is not an anatomy 58 structure. So we're going to call this parietal pericardium, even though it's both parietal and fibrous pericardium. And so all the shininess out on the outer surface of the heart, that's all visceral pericardium. This heart here has been sliced sagittally, so we can open up and see some structures on the inside. I'm going to come back to them, but I wanted to show you this little thing right here. That little doggy ear thing, that's the left auricle. That's what the auricle looks like. Do you see how it's really on the outside?
It's so tiny though.
Well, yeah, the left one is smaller than the right one, but this one doesn't have a very good right one. Better right one is over here, although it's kind of been folded a bit. That's the right auricle. Okay? And you can see it's really on the outside of the heart. There's really nothing inside about it.
And what's its function again?
I didn't tell you its function.
Oh, never?
But I will tell you its function. You don't have to know it, so shut your ears if you don't want too much information. Sometimes a lot of blood comes back to the heart fast, and if there's too much to fit in the atria, then it goes into the auricle as kind of a extra room. Okay. So on this heart, again, it's been split open. So this is right side of heart. This is left side of heart. Compare how much muscle is on the left side versus on the right side. Do you see how it's thinner on the right side? Well, where does the blood go from the right side of the heart? It's just going to the lungs, which are right next door. But from the left side, it's going all over the body, including up. So it needs to be bigger. Do you see papillary muscles and chordae tendineae? Okay. This sort of white smooth stuff, that's the actual valve itself. What valve is that?
That's the bicuspid.
That's one name?
Mitral.
Mitral, bicuspid, right,
left,
AV. Not right and left. But
Left.
yeah, you guys get a point. It's left. It's left. AV. Just this is. Okay. So you see papillary muscles, you see chordae tendineae, right? Okay. Over on the right side, this is part of the wall. That somebody pulled that off. I'm going to just hold it there. So here again, you can see papillary muscles, chordae tendineae. The smooth, sort of shiny stuff, that would be the left AV valve, aka
The right.
Right.
Oh, so
No,
tricuspid.
Twice.
tricuspid. Damn. You guys are cleaning up. Okay, and on this heart here, you can see, what would this structure be?
Pulmonary trunk artery.
Pulmonary trunk artery. And if we open up the ventricle, yeah, so I'm going to have to show each of you this way because it's right where they cut it. But this is going to be the pulmonary semilunar valve right there. If I go through there, then I'm in pulmonary trunk. And it's kind of thrashed because it's right at the fold. But that would be pulmonary semilunar valve. So this is what blood vessel again?
Pulmonary trunk artery.
Pulmonary trunk artery. And right here at my fingers, it only goes that far and then it divides. So this is actually a blood vessel that goes that away. I'm not going to say right or left since I've gotten that wrong so many times, but you're going to tell me.
Left pulmonary artery.
Left pulmonary artery. So where's the right pulmonary artery? Well, it's actually going to go from here behind the aorta. So here, that's right pulmonary artery. Okay? And here you can see the aorta, and they've cut the aorta open.
Wow.
Okay.
That's thick. Very big.
Yeah, this is the biggest and thickest blood vessel in the body. So we have ascending aorta, we have aortic arch, we have descending aorta, and that's where they cut it off on this one. So I'm sticking my probe in a blood vessel. What is that?
is the cleft.
Brachiocephalic trunk artery.
Brachiocephalic trunk artery, exactly. And this one would be
The left common carotid artery.
left common carotid artery. And on this one, Gabriella's not going to respond.
The left subclavian artery.
Left subclavian artery. Good. Everyone's got that.
Can I ask a quick question?
Sure.
I get the pulmonary trunk and the aorta mixed up. So how can you remember that if I can't see the whole thing? I mean, obviously.
Well,
bends.
okay. So here's an actual heart, and I'm going to face it to you. The vessel right front and center, pulmonary trunk artery. The aorta is actually farther back. It's a
Okay.
little more posterior.
Okay.
Okay, so you can see that on all the pictures there. What's actually
Okay.
right in front,
Okay.
most anterior, that's pulmonary trunk
Okay.
artery. And I'm looking here for coronary arteries. And, well, we can sort of see one. So what I'm going to do is this blood vessel right here, that's the pulmonary trunk artery. I'm going to pull it forward so you can see the aorta from the side. Can I do this? No, I can't really do it, not clearly. Never mind, I'll do that on another
Pulmonary
one.
vein.
Can you see pulmonary veins? Well, let's see. Here, I'm going to put my... Can I put my fingers in it? Yes. Okay, my fingers are now in. I'm sticking my fingers through the mitral valve, and my fingers are now in the left atrium. Am I doing that right? No, I'm not doing that right. Let's do it right. Now my fingers are in the left atrium, and 1, 2 pulmonary veins. This is what the 2 pulmonary veins, actually that used to be closed there. I want to switch hearts to this heart. This heart is opened in slightly different area. Can we see better valves? Oh, we can see nice, or, well, it's darker. Yeah, I think it's just how they preserved it. Not happy with this one. I'm going to go to this one. Okay, so this, by the way, that's lung tissue.
Okay.
So all of these tubes here, those are air tubes. We're going to learn about them starting with the lecture right after our Tuesday exam. But that's lung.
That's a lot closer than I was expecting.
Yeah, that's how close the lung, or one of the lungs is. So check this out. What do you think this is?
Aorta.
That's the aorta.
Thoracic.
Well, it's like all the aorta, so we'll start here. So the pulmonary trunk artery is here. And can I go behind? I can kind of go behind and get into the right pulmonary artery, and the left pulmonary artery is actually going right into the lungs here. But let's look at aorta. Here's ascending aorta, aortic arch, descending aorta, and between about here and about here, that's posterior to the heart. So between my fingers, thoracic, and all of this would be
Below the diaphragm.
abdominal aorta, and then it divides.
And is that going down the leg at this point?
No, it's going straight down the middle of the body,
Oh, is that
and
the
this
renal?
happens sort of in the pelvic cavity, and it's dividing into 2 big pieces.
Common
Stop
iliac.
that. Stay there. So this has a first name.
Left.
Great.
Oh.
No?
Right
Common.
Right common
Iliac.
iliac artery. Left common iliac
Is that
artery.
short? That's going. That's from there to there.
Well, yeah, between like there and there.
Oh, what creature is that? Is that a lamb?
This is human.
Oh, it is?
Everything you're looking at here is human.
Oh.
So what would this be?
No.
That would be the greater.
No.
No.
Great. The
Not great.
right.
Right.
Saphenous.
Right.
But those are veins.
No, sorry. My bad.
What was this?
The extra.
Femoral artery?
This
Aorta.
aorta, which is an artery, and this was the right common iliac artery. So what's going to come off of this is still going to be arteries. Okay,
The right.
Femoral.
Oh.
it's not external.
Right intern. internal iliac
Oh, yeah,
artery.
yeah.
Sorry.
Right
Okay.
internal
That's right.
iliac artery. This
Oh.
is the right external iliac
Yeah.
artery. And if we keep going on that, then we'll run into the right femoral artery. Okay. Now, up here we've got aortic arch, and we've got 1, 2, 3 blood vessels coming off it. Gabrielle is not going to talk. So what am I touching right now?
Brachiocephalic trunk artery.
Okay, good. Kendra's now not going to talk. What's this one?
The left common carotid artery.
Okay, good. Angie's out of the list. And this?
Left subclavian artery.
Left subclavian. Good.
Good
Okay.
memory.
Who's next? Who's next?
Okay, so this is left subclavian artery. I'm going to come back here and notice that the brachiocephalic trunk artery goes a little ways and then divides. One part goes up. Anybody?
Right internal.
No,
General
right
artery.
common
Right.
carotid artery.
Right, common carotid artery. It's an artery, it's not a vein, and if it's an artery, it's carotid
It's a vein.
and
It's
it's common. And do you see this one goes this far before it divides into two parts? Okay, you don't need to know the two parts, but this is the right external carotid artery and this is the right internal carotid artery. But remember, trunks go about an inch and commons go a little longer.
That's why it's common.
That's why it's common,
Because of this. Oh, I
because it's
didn't
going to
know
go
that.
somewhere and divide. And what would this piece be here?
Because of the length of
the
it.
right subclavian artery.
Right, subclavian artery. Good. Okay. So there's more on this model. This is a structure that's posterior to the heart. That's the trachea. And posterior to the trachea is the esophagus.
Oh, wow.
Okay? And this, you can feel it here. And if you've got gloves on, you'll be able to feel it. This is the larynx. That's the voice box. Do you remember the epiglottis we were talking about? That's the epiglottis. And down there is,
Looks like a little lamb tongue.
I wouldn't know.
You got this thing with lambs.
And so if you are holding it carefully, you can look down into the larynx down there, which is something we will talk about on the lecture after the exam. And so what is this?
Is that a
It's
tongue?
Tongue. That's a tongue.
Tongue.
Get out.
Oh, ew.
Oh my
Why is
Yep.
it so thick?
It's not lamb tongue.
It's just
Well,
human
it's
anatomy.
just kind of
human structures.
it's been in a jar for a while. But your tongue is actually kind of that thick, except for the little part
Oh,
of it.
it's connected.
It's all connected.
Okay. So these are here
So
for you to look at.
be all the way from here to here.
Oh, I wanted to see if I could
It looks
show you
so
some
short
veins.
together, huh?
Yeah, like you think it'd be.
Okay, let's see. Can I show you a vein? Vein, vein, vein.
They're not all Gene Simmons. Gene Simmons. Crazy long
Let's look at this one. So here I'm now going to see if I can stick my finger. This is the right atrium. Okay, so the right atrium has an inferior opening right there. My finger is in the inferior opening of the right atrium. What would that be? Inferior vena cava. And it has a superior opening, which is right here. Superior vena cava. And the question is, can we see fossa ovalis? Yes, you can.
Oh, yeah.
Okay. I'm going to hold this, and you see this sort of oval area right there? Hard to tell, but that's fossa ovalis. I'm turning this. So fossa ovalis is going to be right there, the end of my probe.
Oh. Wow. That light area.
Opening of the coronary sinus. Let's see. And the trick is, can we look in? How do we look in? We have to look in from a vessel. So let's try from the inferior vena cava. It's there, but it's kind of hard to see. So I wouldn't be asking you on a lab exam. So if you folks want to take a look at these and move around your hands and touch them, that's okay. Just be a little careful. I need to write your names down, so don't do